Hello, I'm Dr. Harold Thompson. I'm one of the staff physicians here at An Insured Recovery. I'm very pleased to be able to give a brief talk about something that's called hepatitis C. Hepatitis C is a serious liver disease, and it's caused by the hepatitis C virus. Some people get only a short-term or acute infection and are able to clear the virus without treatment. If someone clears the virus, this usually happens within 6 months after the infection begins. However, about 80% of people who get infected develop a chronic or lifelong infection. Over time, chronic hepatitis C can cause serious health problems, including liver damage, liver failure, and even liver cancer. Now, what are the symptoms of hepatitis C? Now, the hepatitis C can include fever, feeling tired or exhausted, not wanting to eat, upset stomach, throwing up, dark urine, dark-colored stool, joint pain, yellow eyes, and yellowing of your skin. We know it generally as what? Jaundice. It's related to the bile salts, which is a chemical produced by the liver, which is a part of digestion and helps us to break down fats. The liver overall filters all of our blood and helps to remove chemicals, toxins, and it will also help with digestion of the body and absorption of crucial materials, vitamins and things of that nature. Now, many people who get hepatitis C do not have symptoms and do not even know that they're infected. In fact, some people have been known to have hepatitis C for 40 years or more. So just because you may feel normal does not mean you may not have the hepatitis C virus. So we're going to talk shortly about the importance of screening and checking our blood to make sure that that's not a problem that we may have. If symptoms occur with acute infection, they can appear anytime after about 2 weeks after the exposure to about 6 months after the infection comes about. Now, the symptoms of chronic hepatitis C can take decades, as I have said, to develop. And when these symptoms do develop, they often are a sign of advanced liver disease. That's why it's very important that we test ourselves and become aware of the possibilities as early as we can. Now, the question comes, should I get tested? And the answer is yes. If you have ever injected drugs or used dirty needles or things like that and other issues that we will talk about, you should get tested for hepatitis C. If you are currently injecting, you need to talk to your doctor or provider about how often you should be tested. Now, hepatitis C antibody test is a test that looks for the antibodies to the hepatitis C virus. These are proteins that are produced as a result of infection by the hepatitis C virus. Now, a reactive or positive hepatitis C antibody test means that a person has been infected at some point in time. But unlike HIV, a reactive antibody test does not necessarily mean that the person still has hepatitis C. An additional blood test called an RNA test is needed to determine if a person is currently infected with the hepatitis C virus. Now, how is hepatitis C spread among people who inject drugs? Hepatitis C is very infectious. That's the hepatitis C virus, and can easily spread when a person comes into contact with surfaces, equipment, or objects that are contaminated with infected blood, even in amounts that are too small to be seen by the eyes. So that's the reason we need to have these tests. The virus can survive on dry surfaces and equipment up to 6 weeks. People who inject drugs can get hepatitis C through various mechanisms. What are those mechanisms by which you can spread it or at least get infected by it? Very often, dirty needles and syringes are a major source of this infection. So sharing or reusing needles and syringes increases the chance of spreading the hepatitis C virus. Syringes with detachable needles increase this risk even more because they can retain more blood after they have been used than syringes that have fixed needles that can be discarded afterwards. Now, how else can we get exposed to it? We'll call it preparation of the equipment that's used. So any equipment such as cookers, cottons, water, ties, and alcohol swabs can easily become contaminated during the drug preparation process. Fingers that come into contact with infected blood can spread hepatitis C. Blood on fingers and hands can contaminate the infection site, including the cottons, cookers, ties, and swabs. What about the surfaces that we are using? Hepatitis C can spread when blood from an infected person contaminates a surface, and then that surface is reused by another person to prepare an injection.